Dr. Stroman, thank you for the wonderful introduction. So, as she stated, I'm currently the Disparities Coordinator for the Division of Neuroscience. It's a pleasure for us to talk to you today about our priorities for minority health and health disparities research. And so, this presentation is going to focus on what we've done within our division and the work that we plan to do with other entities within NIA. And so the National Institute on Aging is the leading institute for aging research. We support and conduct genetic, biological, clinical, behavioral, social, and economic research and training. We foster the development of research in clinician scientists and aging. We provide research resources, and we also work to disseminate the information about aging, particularly advances that have been made in research to the public and to a wide diversity of our communities, whether it's healthcare professionals, the scientific community, or to the lay public. So the Division of Neuroscience is one of the 4 divisions within NIA, and we've been charged with supporting research that would lead to better understanding of mechanisms of brain aging in Alzheimer's disease and related dementias. And the division utilizes a comprehensive approach that allows us to examine the etiology of the disease along a continuum, including basic biology, all the way to population level studies, including epidemiology, behavioral and social research, and translational and clinical research. So when we think about minority health and health disparities, particularly when I came from the NCI to NIA, these 2 studies were striking to me. We think about such studies, these observational studies of AD and RD, which has documented significant differences in the incidence and prevalence of AD and ADRD among our US race and ethnic populations. So if we take a look at the graphs on our right side, we know that we could see that there's a higher age-adjusted incidence among African American and American Indian and Alaskan Native populations. And there's also a higher prevalence among African Americans, Hispanic, Latino, and American Indian and Alaskan Natives. What is also important to recognize is that we see these disparities when we look at other health disparities indicators or look at other medically underserved groups. So we do observe higher burden from disease, including AD and sexual gender minorities in rural populations or in women. And it's important to remember that these characteristics often intersect with race and ethnicity. And I will get back to this point later on during our presentation. So furthermore, there have been several studies that have investigated the neurobiological and the neuropathological features and biomarkers that have been associated with AD and ADRD among race and ethnic minorities. And these results have been, not surprisingly, quite inconsistent. So some of these studies reveal differences, while other studies reveal no differences. Now, there are a few reasons that we could point out that would lead to these inconsistencies. We may say that the sample sizes are small or the populations are not representative. In some of these studies, we don't see some race or ethnic groups represented at all. I think most of these studies have looked at African Americans, a few at Hispanic populations. So what this suggests is that we need a further evaluation of the ATN framework, but more importantly, we need to consider diverse population within the context of various environments. So introducing this idea of precision medicine or precision public health. So precision medicine allows for the development of treatment, prevention, and intervention strategies that takes into account variability of a number of different factors in genes and different environments and behavioral and lifestyles. And the NIA Health Disparities Framework, which has been presented throughout your conference this morning, indicates that minority health and disparities are influenced by several factors across several levels and domains. And it operates over a life course to shape the etiology of AD and ADRD and also other aging diseases. So the NIA Health Disparities Framework is a really good example of presenting multiple factors across multiple levels, which will allow us to delineate the causal pathways and broaden the scope of targets for intervention. So this next slide lists a few of our interests and trying to address issues not only in terms of the research but also in what we're providing in terms of infrastructure, right? Um, so it within our division we strive to support research on recruitment and retention of diverse populations. We support research to understand the demographic diversity of dementia risk that goes beyond the description, to identify factors driving disparities. We support research that looks at the relationship of race, ethnicity, and additional demographic diversity on risk and resilience for mild cognitive impairment or AD. We support research that looks at disparities in diagnosis and assessment procedures, including cognitive testing procedures, clinic participation rates, and other assessment procedures. And more importantly, we are starting to support research that really investigate and incorporate the multi-level and precision medicine approaches to understand neurobiological and neuropathological differences among diverse populations. And we are also interested in looking at genetic studies of ADRD, making sure that we're including diverse populations in our studies. So in the next few slides, I will give some examples of some of the work that we're supporting within our division. So the recent recommendations from the AD Summit specifies a need to diversify our research cohorts and to improve methods and tools for conducting research among minoritized populations. And so there's really a need to broaden the scope and improve the rigor of the scientific investigations that are being proposed, and that are considering disparities and incorporating multiple factors into the work. And so we aim to do this through this NOCI that was just reissued. So this is a new a reissuance of a NOCI that had expired, called Health Disparities in Alzheimer's Disease. And we do this in collaboration with our colleague in the Division of Behavioral and Social Research. And so this is an example of a study that is investigating the brain and ethnic disparities and ADRD risk in Arab Americans. And I'm not going to go through all the risk factors that they've included, but what I wanted to point out is just a representation of data from multiple domains and levels of influence that will enable a comprehensive investigation of the causes of disparities in aging and AD and related dementias within this community. In addition, it's really important to ensure that we have outstanding representation of minoritized populations within large-scale sequencing projects. So we know that minorities remain underrepresented in sequencing studies. There's been a number of papers that have identified that maybe less than 20% of the large-scale sequencing studies include minoritized populations. And most of these include most of the minoritized populations, a large proportion are East Asian populations. And we do know that this is very important because we've seen additional research that have indicated that, for example, tools that are developed to be used in the clinic that for diagnosis of certain diseases, such as polygenomic risk scores, do not translate from European populations to other populations in a way that's effective and clinically useful. And so um, we are ensuring that as we move along with our Alzheimer's disease sequencing project, which is led by Dr. Miller, that we are increasing the diversity of populations in our studies. So we are aiming to include at least 18,500 cases and that many controls for each population to ensure that we are identifying the range of variants that exist in the population genome. And I've included a slide that shows you where we are in the process with some of our populations. Another area that we are addressing is to increase the diversity, recruitment, and retention in our aging research studies. So we know that there's an underrepresentation of minoritized populations in clinical and epidemiologic studies. And we are taking this issue very seriously. So one example is this FOA that is being led by Dr. Elliott to improve research participation recruitment through method development, community engagement, evaluation strategies, and community and cooperation. And this funding opportunity supports teams that support the creation of timely and essential resources designed to enhance recruitment and retention of large community populations for aging research. And these grants are in their second year of funding. We have supported 15 projects that cover several minoritized and medically underserved populations based on race, based on ethnicity, based on languages spoken, and based on other medically underserved populations such as the elderly, hearing, vision impaired, mobility impaired, sexual gender minorities, rural populations, under-resourced populations, and so on. And so it's really hope that this will be the beginning of an infrastructure and experts that could really engage with the scientific community in recruitment and retention of different populations throughout the US. Additional work is being done by Dr. Massett and Dr. Roper in the Division of Extramural Activities. Two recent things that they have started working on. The first one is the CROMS, or the Clinical Research Operations and Management System. And what this does is that it tracks in real time. It will begin to track in real time recruitment and enrollment of populations, particularly those clinical research trials that are enrolling minoritized populations. And the reason why we want to collect this information in real time is that we can do a better job on our end tracking the enrollment of minorities into clinical trials and intervening in real time if there's an issue and trying to address the issue up front rather than waiting until the end of the clinical trial and then realizing that there's a missed opportunity for inclusion for making sure that populations were recruited in the way that they were supposed to. Another effort is on the way to develop a practice-based research network. And the goal here is to use this network to address disparities gap with recruitment and retention of diverse and underserved populations. There was a virtual meeting in April of 2021 to just talk about this briefly. And in the winter of 2022, there will be a request for information on the capacity and support needed to increase community-based research network participation in AD clinical trials. And the objective here is to collect practical insights on barriers and solutions as to how to increase diversity in our clinical trial participants through sustainable engagement of community-based research entities as part of the broader research enterprise. And so, sometimes we work at NIH and we think that we know it all, but we don't really know it all, right? And so we really want to hear from you, right? We need you to help us to do this. And so what the RFI is seeking are comments from stakeholders with experience engaging in underrepresented and historical minoritized groups, community-based research networks, researchers, persons living with dementia, family members of others who are supporting people who are living with dementia, of course, our patient advocacy groups, and anyone else that we haven't included here. So all comments are welcome. So please look out for this. We will definitely reach out to the scientific and to the lay community to let you know when this RFI will be released. And then one thing that we are doing is doing an assessment of our research portfolio within the Division of Neuroscience. So we've supported disparities and minority health research from about fiscal year 15 till present. And so it's really time for us to assess what we've accomplished through the support of those grants. So we want to understand the types of resources that have been created, understanding the types of cohorts, getting an idea of numbers, of the types of populations that are included, the geographic representation of those populations, and then understanding what other resources are available. What biospecimens, what type of data, how are we sharing that data with the community so that we're really advancing disparities research. We also want to identify what are the scientific advances that have been made, but more importantly, we really want to bring the community together to start defining a roadmap and using that roadmap to inform us how we move forward in creating funding opportunities. We also encourage the use of NIA's health disparities framework, and we also plan to continue to communicate with the scientific and lay communities through webinars and through blogs. So these are activities that are coming up this calendar year, so stay tuned. And then I want to just briefly talk about a new funding opportunity that's just hot off the press. The actual funding announcement has not been published as yet, but I could share this snippet of information because this concept was just approved and the link is included on this slide. So I encourage you to click on this link and look at this concept. But the concept is entitled Precision Medicine Approaches in Addressing Minority Health and Health Disparities. And so it really captures the need to look at the whole picture and thinking of how you formulate your research questions, the methodology that you're using to address those research questions, and how you're interpreting that data. And so the plan here is to support planning activities for the development and scale up of research infrastructure and resources to support studies of AD and ADRD and minoritized populations. We also plan to support pilot projects that will utilize a multi-level precision medicine approach that will inform scale up of future research and also support transformative multidisciplinary teams to address disparities, burden or resilience among minoritized populations. So again, stay tuned. When this funding opportunity is ready to be released, we will be sure to share it with all of you. And so to end, we want to continue to increase the representation of diverse populations, not just in our clinical studies, but also in our epidemiologic studies, to seek ways to leverage existing cohorts and data sets for research in race and ethnic minoritized and medically underserved populations, to continue to fund studies that would improve the study design and the creation of tools. We do plan to continue to assess our research in this area annually. So this is something that we will do every year. And we will see where things fall and what improvements need to be made, and to continue to engage in the scientific community and moving the field forward. We also want to continue to identify and disseminate information about scientific advances and continue to seek opportunities for collaborations with other NIA divisions and with other NIH ICs. So I will stop there and take any questions that you may have if we have time for questions.